It
You
would be
are
probably at the
on.
end.
There you go.
Okay.
Yeah, I can let people in.
Okay, thank you. Well, we'll get started then. Okay, well, we're going to get started right now, and welcome to Gray Anatomy on a very warm July afternoon. If it gets any hotter, I just don't know what. But it's nice and cool in your house, I hope. It's cool here. We have Jason Ham from Blue Ginkgo Center for Chinese Medicine, and I want you to know um, we had a video problem with him, so he can't see a thing.
I
The only
cannot.
thing that works is his camera. He's shooting from behind. So I'm going to watch the chat box. If you have questions as we go along, please put them in the chat box. And when he takes a breath or has a pause, I'll try to get your question to him. And before we get started, we always want to thank Capital Federal. Where would we be without them? They fund all our retroactive activities. We're very, very grateful. And also Sharon and David Katzman, whose foundation also helps us keep the power running and the events coming. So we are grateful to them as well. I'm grateful to see so many of you. I would just wanted to quickly say that in the summer, we're in the habit of not doing gray anatomy because our providers are provided by LMH Health, and they take the summer off. And Kathleen and I thought, well, wouldn't it be interesting to look on another shelf of the library? And so we're looking at something that you might have heard of, you might have tried, you might have more questions about, but you've never learned about it. So this is Jason, and he's gonna kind of just be a talking head, but a very charming one, and he will get us going here. And he's flying on instruments, so
Yeah.
we'll be careful of that too. Jason, I'm just gonna get it started with you. The first thing you could do is just tell us your story. It's most interesting to be an acupuncturist in Lawrence,
Yeah.
Kansas. How did
Yeah.
you
So,
tell us your background?
well, my background starts in Pratt, Kansas, South Central Kansas. That's where I grew up, a dairy farm, no less. I'm fifth generation farmer, basically. And a lot of experience on the farm. And as I went through school, I got interested in medicine. And come to find out, the farm actually went under during kind of the 80s farm crisis. So dairy farms just could not compete. And so that forced our family to move up to Topeka, um, where going into my junior year of high school, I started volunteering at the at Stormont Vale Emergency Center, the emergency room, and that led into people wanting me to work there. I guess I thought I was, enough to uh, want to get a job, and so I did. And so late high school and actually through college, I actually worked in um, the surgery department there at Stormont Vale. And that, of course, gave me so much hands-on experience, access to doctor stories and patient stories at the same time. Um, Administrative staff, like you name it. I was just floating around there getting as much information as I could because I was interested. I captured an interest for medicine. And one thing led to another. Of course, I loved that work, but on the other hand, there was some things that I didn't feel integrated towards. I didn't feel that were necessarily part of my uh, ethical values. And while I love that environment, I decided that, there were certain areas of Western medicine that were just completely underserved. And the main one that I really captured was pain management. And, so many people were just like, having a hard time capturing a solution that was, more in line with their value system as far as like, I don't always want to be on, these medications. They make me feel a certain way. Of course, certain occupations, um, there's like, I can't be on, these drugs, say firemen or firefighters. There's a lot of professions that just, really does not serve them to being on certain medications because it, you know, the side effects, unfortunately. And so, long story short, you know, eventually I came to looking for additional options for, you know, filling that niche, and really just landed on acupuncture within the Chinese medicine scope. And so after college, so I went to Kansas State University for my undergrad. I majored in biology and business. And then after that, went out to California, where I did my post-grad work in acupuncture and Chinese medicine. And so here I am, you know, 16 years later after starting practice. So that's where we are now, and in a nutshell. So yeah.
Well, that's quite a, that's, it's most interesting. So what exactly attracted you to Chinese medicine? I mean, I can understand that pain management
Yeah.
is a big in a medical world. And I know whenever I've had to take a big pain drug like that, don't operate heavy machinery, don't drive
Yeah.
and all that.
Yeah.
So I understand that, but what drew you to the Chinese medicine? That's
Well,
interesting.
well, because of its historical, um, I would say, scorecard of pain management. That's one thing that has been valued within that tradition for such a long time. It's got such a reputation over time for being, you know, a really good modality, a really good tool for pain management. That's the one thing that really stuck out to me is, um, you know, what is the best tool for pain management? Well, there's multiple tools. However, this one's the most long-standing, the most that I could research, where you could get an education um, for it. And so that was where I, you know, made my search, and the best schools ended up being, in my opinion, on the West Coast, where a lot of those teachers that I encountered, they were even, I had 3 teachers that were there due to the Cultural Revolution in China, and they were, you know, skipping out and trying to get a better life for themselves. So it's a very small connection between, you know, that major cultural shift politically in China to where they landed in California to continue on their education. And so I searched out the best schools and landed um, at Five Branches University, which was in San Jose. So bottom line, you know, it had the best record for dealing with pain that I could actually find an educational source for.
Okay. And I'm kind of wondering, so what, how long is the course of study, and what kind of classes do you take when you're getting a
Yeah.
degree? Is it a degree like an MD or a
So at the time, it was technically a master's degree. So you could go in with an associate's and then come out with a master's. In California, I think the credentialing has changed a little bit, where they actually require a bachelor's and then you come out with a PhD. Um, yeah, I don't know if it really makes that much difference. You know, I don't know. I have mixed feelings about it, honestly, with the credentialing profiles. But the education is 4 years. So you go in, and so much of your education, I can't remember the thousands of hours that I did with acupuncture, but it's also, I think 3,000 hours, education hours for the Chinese herbs as well. So that's not something that is a high profile part of my business because I'm, you know, 90% of my business really is acupuncture and pain management. However, I'm also extremely skilled with the herbal medicine side. Um, there's just some, you know, some drawbacks to herbal medicine as far as compliance. I mean, nothing tastes good, but when you really need them, they're actually really effective.
Okay, that sounds very interesting. And by the way, everyone listening, if you have a question, please go ahead and put it in the chat box, and I will be sure to make sure that
Yeah.
Jason hears it.
Yep.
So you were out in California, and my
Yeah.
understanding of California is that everything goes in California, and believe I was told that acupuncture is actually covered by health insurance. Your health insurance will cover acupuncture
Yeah.
in California, plus all kinds of other interesting things. But that is not the case in Kansas. So I am
No.
wondering what brought you back to the heartland.
Well, that's the heartland is where my heart is. And California, I could be a primary care physician. That's, with their credentialing, and the training that we receive, which is also, which I didn't say before, there's a big section of our training out there that's Western medicine. So we do, classes for X-ray imaging. We have a whole Western medicine side of that curriculum. And that school actually partnered up with Stanford University as a collaboration course to get people involved with both sides of that. And so getting that kind of experience on the Western side is actually very, very valuable. And so anytime in my practice, I have both of those tracks running. I have Western medicine going, I have Eastern medicine going. And so I think there's a lot of value to that. And like I said before, I'm never one of those alternative practitioners that says Western medicine is junk. No way. There's always, good tools. You just have to use the right tool for the right job and allow people to understand what that looks like. And that's probably the toughest thing. But again, like, yeah, California is very different. They have employees that came out of our school that they hired into Kaiser Permanente, which is their big hospital franchise, we'll say. But yeah, it's extremely integrated there. And coming back to the Midwest, I mean, this is where my heart is. This is where my people are. So I'm here.
Okay, well, we're glad you're here, and there's a question already. The question asks, what are some of the most common conditions that patients come to you with?
Oh
What do
yeah.
you see most often?
Oh, probably my top five, I would say. I would say shoulder complaints, neck, low back, um, knee, and hip.
Okay,
Those are my top. And
okay,
then probably second tier to that, chronic headaches and some other, you know, secondary things. But I tell you, I work on every single part of the body. And doing this job in this community for 16 years really allows me to um, get a profile of what I can expect and what kinds of things I see. And it's been really fascinating to see. Um, I see certain things over and over and over again because I am essentially the last resort of the last resorts. And so once people get into my office, I can almost categorize it into probably six or seven things that they're coming for.
okay.
Because, there's a lot of things that just resolve on their own, or that Western medicine can treat, or massage, or maybe a chiropractor, whatever else they're doing. And then, network here in town with many practitioners. Once they get to my office, I can almost guarantee it's probably seven things.
Okay, and I want to tell everyone, if you haven't looked at his website so far, it's very straightforward, and I think it's talk about transparency. Jason says, "I'll tell you straight up if I can't help you."
That's right.
He doesn't string you along to come back for the next 10th time, but I've got a couple of questions here. Let's start with the first one.
Okay.
Um, do you treat neuropathy?
Yes. It depends on what kind of neuropathy it is. I see anything from, diabetic neuropathy to other forms. There's numerous ones caused by numerous things.
Mhm.
And neuropathy is interesting because I always find that there can be multiple components, multiple facets to neuropathy. And I feel like sometimes people get pigeonholed into that diagnosis. And then there can also be additional soft tissue compression on nerves that are creating the same condition. And so it gets kind of overlapped, and it's difficult to know what kind of treatment is available. And so I always tell people, if you have neuropathy, let's look at it, let's figure it out, because oftentimes, um, let's say you have the worst kind, like say diabetic neuropathy. Well, and there's some cases where you might have, just like normal people, have some muscle compression on a nerve group that's causing the same sensation, and it has nothing to do with it. So you really need to have an open mind. And one thing that I know about my practice is that I've learned to really just, when someone comes in blank slate, they'll come in with diagnoses that they've had for maybe years, and then I look at it with fresh eyes, because you have to. If something's not making sense, unfortunately, a lot of people get pigeonholed into their diagnosis they received, and so then everything that they have after that diagnosis must be related to that prior diagnosis, and it's often not the case. So it certainly can be, but I'd say 6 times out of 10 it's not. So you have to um, diagnose things with fresh eyes, and that's been a big part of my practice here.
Right. And I would like to say to everybody as disclosure, I did go see Jason when I had some back pain, and even had leg pain, and even had 3 epidurals, which did nothing. And if you go to see him, what you're seeing here, even though he's working from behind, you're talking to him. You're
Yeah.
not, you're just talking to him. And he told me that people usually tell me within 10 or 20 minutes what's wrong with them, and I can tell, and he listens.
Yeah.
So that's a great
Yeah.
skill.
So on that point,
Apparently without a diagnosis on top of it.
well, it's really fascinating, because I feel, if you just listen, um, people will almost subconsciously use certain words to describe their pain. And I realized that, people are using like key words to describe certain muscle groups. So um, let's see if I can give an example. Let's say um, they'll say shoulder pain. Okay, so if shoulder pain's involved, the key word that they'll say is something about sleeping on their side at night. And I know it's one muscle. It's pec minor. It has nothing to do with on the back side of their shoulder. It's always pec minor. Or let's say hip pain. They'll say maybe I have a hard time getting in or out of my car. They'll mention their car. Um, and I know exactly what muscle is involved. Or one other instance that is very common is I have a hard time, like my pain in my arm when I'm holding a coffee mug. It's like, okay, I know exactly what muscle that's going to be. And so they'll repeat, certain experiences. They're relaying really important information. And so I learned to just be really quiet, listen, and not make preconceived ideas about where I should go first. So
Mhm.
um, that's been actually a very valuable tool that I've just kind of learned. You know, being a very simple practice, I never enjoyed or wanted to be a part of quote unquote high volume practices. I like the one-on-one. Of course, I don't make near as much money doing it, but it's quality over quantity in my opinion, and that's all I want to do. So
That's great. And
yeah,
I think when we talked, he also mentioned, as he just said, people generally point to it,
yeah, they'll
you
tell me
know.
exactly what they need, almost
Exactly.
subconsciously. If
It's
if you
good.
just watch and listen,
Yeah. Well,
yeah,
it's good to have somebody who's not hard of listening working with.
right, yeah,
Here's another question. How do you treat migraines? And if so, how?
yeah. So migraine's pretty multifaceted. It depends on the migration of the migraine. Sometimes the most common I would say I look at is where it kind of maybe starts in the back of the head and kind of wraps around, then ends up in the front. Um, those are more tension headache, and those are more related to the muscle groups that are compressing this nerve. And I wish I could remember that nerve, but I can't. I'd have to look it up, honestly. But it kind of wraps around the front, and then that can trigger, full-blown migraines. Migraines can be, they can be around, women's periods. They can be around, barometric pressure, which is kind of a vasodilation, vasoconstriction of blood flow. But the most easy to treat with acupuncture is going to be the tension headaches, which are actually involved with muscle. So,
Okay.
A lot of headaches, I think, is because of our, device world. It's like, here's my iPad and I'm, looking down at it, multiple hours a day, and which really just strains, the backside of your neck. And, over time, they just get overstrained and start causing headaches or migraines because they're really punching that nerve that's underneath there in the neck.
Do
So,
you ever use Chinese herbs with migraines?
um, you can. I find the most valuable, most repeatable remedy is going to be more in the mineral category, making sure people have enough potassium and magnesium,
Okay.
to make sure muscles are staying in relaxation phase. And
Okay.
so, especially college kids, I work on college kids, where, they're just, over books all day long and over their devices. And of course, a lot of it's muscle, but, at the same time, their lifestyle, you punch them with a little bit of magnesium and, they're good. So, and that goes for a lot of people. So,
Yeah,
uh,
thank you.
yeah, those are always things I inquire about. Of course, nutritional aspects, for related to pain management to keep muscle health.
Yeah,
Is a big thing, big key.
yeah. Here's a question. I have done acupuncture for my knees. There was some small relief, but nothing long lasting. So, is this something that needs to be done periodically? And if so, how often and for
Okay.
how long?
Well, it depends on circumstances. It depends on, activity load. For instance, if you're doing running, knee pain, I work on a lot of knee pain, and there is so much knee pain that really relates to much higher in your hip on the front side called your tensor fascia. It's a muscle group that's actually on the front side of the IT band, and having that tension on the outside of your leg versus the inside creates a lot of knee pain. And that's one of the top things I work on, and I have for a very long time. Um, and so, depending on your scenario and your situation, um, how often do you need it? I mean, my intervals generally with almost always, but rarely, I would say 1 week apart is really all you need. Anything
Mhm.
more than that, I don't know that I see a significant benefit to that. I like the week interval because that allows, when I'm really getting into the muscles that are involved, that allows enough time to let that muscle group go through its regeneration phase. It's like you work out, oh, I'm sore for 2, 3 days, recovers, and then, in a week, you're ready for another one. And so acupuncture is really catalyzing some of that muscle release. And for knees specifically, your highest value target is going to be the lateral outside or the lateral side of your leg, IT band, but up into the top hip. Um, I I probably work on that scenario 5 times a week. So
Okay.
it's something I see
Great,
extremely often. And so if you're
great.
not getting full relief on the knee, um, depending on your scenario, there can be other deeper things, obviously. You get into knee injuries like meniscus and other stuff. But if it's just, I get a little bit of a knee pain, maybe it's kind of cutting across, you know, um, I find that scenario to be pretty predictable, to be the top of the hip.
Okay.
Jason,
So, yeah.
question.
There's a question here. Do you use acupressure?
No. Reason being, acupuncture is a completely different principle than acupressure. And it's way more efficient. And so, because I have the ability to do acupuncture, I don't want to do acupressure, because it doesn't give the results that, you know, I would easily get with acupuncture. And so that might put us into a different aspect of conversation with it, which is, what is the real principle behind acupuncture versus acupressure? And so if people are interested in that, you know, I can go into that a little bit as far as what I
Okay.
feel is this true mechanism behind acupuncture versus, say, you know, pushing on a place, etc. And there's a very different principle behind it.
Okay. Here's a question. Someone asks, what about stress, anxiety, depression, those
Yeah.
types of maladies? Do you work with those?
I do. I actually get quite a few referrals from therapists in town, and I'd say my primary experience has been, you know, chronic PTSD, some subsets, obviously, you know, anxiety. And what I find the most often is just acupuncture is really working on deregulating sympathetic nervous system. So a lot of therapists will talk about, you know, injury, trauma, being integrated into the body itself. And I have found that I think to be the case because you know, if you come in for trauma, um, and anxiety, I don't need to go into any details about what your experience was, how that trauma happened. It's not, I don't think it's helpful to reestablish those pain pathways. What acupuncture is essentially facilitating is a deregulation of sympathetic nervous response. So, sympathetic nervous response is your fight flight. That's your, when you're feeling in danger, you're up here, and that's a certain, you know, nervous response. And the opposition to that is parasympathetic. That's your relaxation response. And so acupuncture catalyzes and readjusts that sympathetic down. It deregulates it, and so sympathetic can start coming back up. And so I always, you know, I call it grounding and consolidation. And there's other people that might say, you know, like, you feel more back in your body. And I can see that. But it's a deregulation of the sympathetic nervous response. And it's been well documented that acupuncture can adjust that. The technique is completely different. And I mostly work in actually the tummy area, the stomach, because that is where, for those that, you know, want to go down a little rabbit hole, the enteric nervous system, enteric nervous system, and it's a completely different nervous system that actually is directly connected to the brain, but also completely separate and functions separately. And so you store a lot of, you know, when we always say, colloquially, we always say, you know, my gut feelings. Well, that's real. You actually do process information in that enteric nervous system. And so when things are feeling, you know, unsafe, you know, your digestion shuts down, your, you know, blood flow goes back out to your limbs, and you have heightened awareness, dilation of pupils, you know, you name it, all that sympathetic nervous response.
Yeah. I have a book called the title is Your Body Speaks Your Mind. And I think that's well said, because, or
Yeah.
what is Gabor Mate's book? Body, the same idea, but here's another question.
Yeah.
How does dry needling differ from acupuncture?
Yeah. Oh, I get this question a lot.
I bet you do.
Yeah, I do. And that really just kind of came up in the last, I'd say probably 2, 3 years. And it's the tool is no different. I mean, an acupuncture needle is an acupuncture needle. Dry needling, it's the same tool. It's just a monofilament needle. There's no hole in it like a hypodermic, like you would get a shot. Um, and it's essentially, it's the same tool. It's just that, physical therapists and, other aspects of Western medicine have co-opted acupuncture to start integrating it in their version of um, their version of acupuncture, essentially. So, yeah, I don't have a lot of information. I've tried to look it up to see sort of what their um, theoretical structure around it is, and I can't really get a straight answer. So I'm not real sure. I get differing, I get a lot of people that have had it before and they try to tell me about their experience. And so I'm not really sure what their training is. I know it's not very long. But Western medicine is certainly co-opting aspects of acupuncture and utilizing that for physical therapy and whatnot. So to be
The
honest, I know it's the same tool, but I'm not sure what their theory is and practices behind their needle selection for points.
Okay. And this next question is in the same vein. Dry needling was considered for hip pain I was experiencing after I had broken my femur. And this question is, what is your perspective on dry needling? And I
Yeah,
think we just heard it more or less, but
yeah, yeah. Yeah, I think it just depends on, it's the same tool with a different practitioner.
right.
Skill set's not in the tool, it's with who's wielding the tool. So,
Mhm.
and that's why, it's like even my experience, I wouldn't get near the results when I started practice than I do in 16 years of practice. So, it's a skill set that actually has to be learned and honed. And I can say, you know, I'm a very different practitioner than when I started. We'll put it that way, because all of my clients over time have been my teachers, and that's a true statement.
Okay. Here's a question, another one. Are chronic conditions like rheumatoid arthritis treatable with acupuncture?
Um, at a basic level, they can be, but rheumatoid arthritis is going to be a chronic scenario, and that's essentially autoimmune aspect. And so you can get some temporary relief depending on, what part of your body, your joint might be affected. Um, Acupuncture is not going to be a tool that's going to give you, it's not going to fix the base,
Right.
you know, immunological condition. It's going to hit some of the surface things. You might feel better for a little while, but no, it's not going to be a fix.
Okay. Here's a question. Where is your practice?
Okay, so I'm located in East Lawrence. I am on 9th Street between New York and New Jersey. So I'm facing the street. My little office is there, right across from New York Elementary School playground. And to the north of me is Culinaria Restaurant, if you've ever been there. Um, so yeah, I'm kind of in the heart of some of um, the most historic aspects of East Lawrence.
Mhm. Mhm. And here's a good question that I actually think I said I would ask you. For
Yeah,
those of us who have never had acupuncture, could you provide an overview of what the acupuncture treatment involves and
yeah,
how it actually impacts pain levels? Well,
okay.
maybe, why don't you just describe an appointment and how it kind of works
Yeah.
and how you,
I think that's a good place.
that is
Every
good.
practitioner's style is going to be different. I'll just tell you what I found works for, my clients. Um, I don't, you come into my office, I'm not going to have you fill out a lot of paperwork. I don't find it valuable. I get all your, basic information, and then I take notes in a notebook that I have. But you come into my office, we discuss, your chief reason for being here, and pretty quickly I can design a treatment, and then um, we go back into the treatment room, face up or face down on my table. Needles get placed in your body, and those needles will remain for about 20 to 25 minutes is really the best time frame. And of course, I come in, check on you, and then let's say you're struggling with a hip or a knee or something like that. Depending on your scenario, then after the needles come out, I always really like to do a couple focus stretches for that muscle system, because when those needles come out, that is the best time to elongate that muscle. So if something's been really shortened and tight and causing pain, those needles come out, that muscle is at its most relaxed place, which is a really significant opportunity to do a couple stretches. And I have found over time that is, just super valuable for patient outcomes. If you don't do that, there's certain scenarios where I just, if you come in and you're holding your arm and things are just super inflamed and sore, for me, it's needles in, needles out, and then I don't do any of that. But, there's most of the time at a certain point, I really like to incorporate the stretching.
Okay. And here's a question. We'll get back to some other things about a appointment. You mentioned your early years on a dairy farm.
Yeah.
Do you feel that contact with animals led to your interest in this type of medicine?
Yes, I would say, because not only animals but plants. And so being around um, generations of agronomists and people that really were smart with animals, and veterinarians that would come visit, etc., I realized that there was pretty significant compartmentalized system between how we think about plants, how we think about animals, and why do we not apply those same rules to humans? And so there was a significant aha moment where I'm thinking, okay, we know, being a biology, major, I'm like, we understand the rules of plants, we understand the rules of animals, and then we treat, say for instance, a plant is sick. Well, you change the soil, you make sure the roots aren't diseased, et cetera, et cetera. Um, Animals, okay, animals on the farm, things aren't going well. Well, let's look at their nutrition. Let's look at their, disease. Are they infected by this, that, and the other thing? So it was either infection or some nutritional base wasn't present. And so then they investigated that. With humans, it seems like it is a completely different rule game. And and the emphasis on, having raw materials in order to operate biological systems, aka nutritional profiles, seem to not exist. And I was like, this is completely wrong. And so that was one of the things that really turned me off to Western medicine, was that, the preventative aspect of Western medicine is just not there. And we're spending, all this money currently on healthcare. And of course, being from a farm and having farm history, a population is only as healthy as their soil. They're only as healthy as the nutrients that are getting into the food supply. And so it made complete sense to me of how those two systems are connected. And that was absolute influence for me, because those two realities, they have to be together. Health and the environment in which you live is one and the same. So that was an easy one for me.
Mhm. Someone mentioned, thank you, Elizabeth, that the Gabor Mate book is The Body Keeps Score.
Oh yeah, okay.
And that is a very interesting
Yeah,
read.
yeah.
Here's another question. How do you see acupuncture evolving or maybe becoming more accepted in mainstream healthcare?
Um, I think that there's a lot of work to do with it. I think we have to start moving into do, plugging more research into the principles behind it, which, you know, ultimately, oh, hold on a second. Hey, Chris, I'm on a Zoom call. Okay. Um, so, where was I?
We have a lot of work to do.
Yeah, we got a lot of work to do, a lot of research to do with it. I think one of the biggest criteria for it is going to be shifting our perspective not on just biochemical responses in the human system, but bioelectrical. And if you want to go down a major rabbit hole, I mean, since really the 1970s, people have been researching, just human bioelectricity and bioelectric systems in biology. And in order for this to really be applicable, and I think that's one of the principles behind acupuncture, is its negotiation with the body's bioelectric aspects, not just its biochemical. So, all the drugs, everything, were just, even my biology classes at K-State, everything was a biochemical interaction rather than seeing a cell is actually, it's actually the reason it functions is because it has voltage potential across the cell membrane. That's what makes the machinery function. If you don't have those electrolytes, in the proper ratios, for instance, a cell will always want to have magnesium and potassium inside the cell, and then it wants to pump calcium and sodium outside the cell. And what that creates is a voltage potential across that cell membrane, which allows that machinery to function properly. And so that is absolutely a bioelectric effect. And so when the focus is so heavy on biochemical, and then all your your solutions to medicine is biochemical, you're missing out on a huge part of medicine.
Right. Right. And I think we all know that our doctors and they have wonderful tools.
They
But
do.
it's mostly uh,
Yeah.
pharmacy is huge.
Well,
And
and yeah, and they're just going to run into a wall with what their solutions can provide.
at
and
times, yes,
and
that could be
at times.
trouble. Yeah.
And so really without, that additional perspective and practice, you're only going to get half the equation.
Well, now we're getting down to it here, Jason, because these are two questions, and I was going to
Okay.
ask you to speak to this.
Yeah.
Um, our okay, are you aware of any insurance that covers acupuncture? Does it require a referral from a Western medicine doctor? And also, someone asks, finally, what does it cost to come and see you?
Okay.
I know you will not shrink from answering those questions.
No.
Okay, first one,
So
yeah, does any
yeah,
insurance cover it? Does it require referral? And how much?
I think Blue Cross and Blue Shield's starting to get better. Um, direct insurance coverage, not looking great across the board for my credentialing personally. Um, again, like I kind of got my credentialing got left out of the conversation a long time ago. I took bets when I started practice that it would probably evolve to where I'd be accepted for insurance. But as it turns out, even if a chiropractor or a physical therapist, I learned today that through LMH, even physical therapists at LMH that are doing dry needling, that's not covered. They, according to them, they had to pay out of pocket for that service. So I think your best scenario is, if you want to sort of cover modalities like mine, having a health savings account is kind of uh, it's your best avenue to obtain some of these services without necessarily, well, you're still kind of paying out of pocket, but at least it's tax free. So, But as far as insurance coverage, no, they have not done a good job. In fact, when I was working with, CFO, long time ago at LMH, she could not figure out how to incorporate this service into, a program, because of insurance coverage. So that's the toughest, hurdle is insurance.
Right. And the question before was similar. Are acupuncturists working to get it covered by insurance? Because that would, of course, make it mainstream. And of course, it is covered in California
Yeah.
and other places.
Yeah. I honestly don't know. I have not checked in with that for a long time. Insurance is kind of such a mess for a lot of practitioners anyway, that, you probably know practitioners that are just opting out anyway
Yeah.
and paying out of pocket. I mean, depending on your insurance plan, you're paying out of pocket until your deductible's met anyway. So, I mean, it's kind of a tough deal. Uh,
Yeah.
I don't know a simple answer to it. I mean, I wish it was, more easily covered. But to answer that previous person's question, I charge 85 for an hour, usually a visit. If I know what I'm, really working on and I can cover it in half an hour, that's 65. So I have not actually changed those rates. I was looking back on my records. I've not changed those rates in 10 years.
Holy moly. No cost of living increase on
Yeah,
you.
no, not for me. No.
Well,
But again, I want accessibility.
yeah.
I keep my life simple, which means I can pass that, quality on to, I'm not here to make myself a lavish lifestyle. I'm doing the work, and
Just you like doing the work.
I want to be available to people, and give them another option at a reasonable rate, because, you know, things are tough for people too. So
Yeah, they are. Uh, this person weighs in again. Blue Cross Blue Shield does cover dry needling, and some policies cover acupuncture to some degree. So I suppose, as
right,
always, since we don't have universal health care, you
right.
check your own policy and see how it works and try to find a
Well,
human being to
yeah,
ask the
no.
question. Yeah.
So for a long time, I tell people the best thing, if you want your insurance to cover it, let's say that's the case, that, your policy is, says on there that it covers some acupuncture. If I, you know, submit medical forms, one, they take forever to fill out. They don't make it easy to submit. They provide so many hurdles for the practitioner to even submit those forms. I mean, I remember, I think it was about 4 years ago, last one I tried. Um, you had to fax the form to them. Okay, so they make it so difficult for you to even submit forms, and then they don't tell you exactly how to fill it out properly. So if you did not cross one T or dot one I on that form, it gets rejected, and they don't educate you about why it got rejected. So
Oh,
you're out time, and you're out, and it is a horrible experience for the practitioner. And so that's
okay.
why so many people are just saying, you know what, insurance is a mess. I'm opting out,
Okay.
which is sad.
That makes some sense. And
Yeah.
another question here is, does acupuncture affect muscles and nerves?
Yeah, directly and indirectly. Of course, muscles and nerves interface. So affecting one affects the other. And so it depends on, what interface you're talking about. There's different subsets of the nervous system and how they are integrated with the muscular system. So, um, some things, I think acupuncture is essentially working more on what's called the somatic side of the nervous system. That's your voluntary muscles. Um, to a lesser degree, it can work on the autonomic side of your nervous system, which is things that just run in the background that you don't necessarily control. Your heartbeat, your breathing, um, your muscle response. For instance, the biggest one I would say acupuncture can affect is let's say, you don't have any mental input in it, but your front muscles and your back muscles are always coordinating together, whether you realize it or not, just to be upright. You're not necessarily putting in, conscious voluntary effort into that system. Those are things that just simply run in the background. Now, I will say, um, acupuncture is great because let's say, this muscle, let's say you do a lot of desk work. Okay. So this system up here, pec minor, is just getting really tight. And all of a sudden now you've got pain on the back of your shoulder. And this is a very, very common scenario where it's people will experience the pain on the back side of their shoulder, but actually the root of it is here. And so your shoulder is trying to neutralize that position to compensate for this shortening of this muscle group up front. And so you do that without even thinking about it. And so acupuncture can affect, aspects of that sort of autonomic nervous response. So yeah, muscles are just integrated with the nervous system. And so you have to understand how that system works so that you can direct your effort towards the right place for your result. And that's or referral pains, which is another common one, right?
Yeah.
You're experiencing pain down your arm, which is a big system with this. You've got a big nerve group right here in your shoulder called the brachial plexus. If you're always working in front of you, or electricians or hairdressers, you work this system a lot, and that can put nerve pressure on this brachial plexus, and then all of a sudden you've got sensations down your arm. And if you just try to, chase that pain down the arm, you'll never get to the root. And so understanding those referral pain systems and exactly what place to work is highly valuable.
Mhm. Sort of like a dairy cow.
Yeah,
By that, I mean, if you notice she's limping, or the tail is in,
yeah, okay.
yeah,
Yeah, because you're using observational data, and
right,
they
right.
can't talk to you. And
Nope.
I had an uncle that was a physician. He was a general surgeon actually, and he would actually he grew up on a farm too, and he would also tell me about stories of baby calves. Like you just have to take all the data observationally and make your decisions. You don't have the luxury of the interview, and
No.
and so I do that as well. I watch people, how they move, how they come into my office, all kinds of different little clues. If you're just observant, you already have it cracked. Um,
Right.
so you just have to be really still and observe and listen. So that's one of my primary practice principles.
Yes. Listen. That's
Listen,
that
be open.
the
And,
whole
and
world
and
could
listening
use.
also just means watching without,
Yeah.
preconceived ideas. That's
Right.
an aspect of listening.
That sounds great. And so this is a perfect question that is probably the last one we'll get to. We have someone who's interested. Oh, here's another one. This one is, how do I make an appointment?
Okay.
Online, text?
Yeah, both. So that phone number is my cell phone. People can text me, call me, and I can schedule them as well. You can also go online. So I made a very simple link. I wanted my website to be really simple. So you go to my home page, and there's a front button just right there on the home page that says schedule an appointment. And that program is really simple. You will see my uh, available times, and you fill in the information, and then you're in.
Okay.
And you'll get a confirmation email that allows you to cancel or reschedule. So it's a very nice, easy, streamlined system that even my hardest critics of technology say they can work through.
Okay. Well, and here's one last thing, and oh my goodness, it's a testimonial.
Oh,
As
okay.
okay. As a client of Jason's for many years, I can personally share that it and he have helped me tremendously. The needles only hurt for a little while, and I
Yeah,
usually forget they're even inserted. So,
yeah. Okay. Which brings up a good point. You know, a lot of people say, you know,
does it
does
hurt?
acupuncture hurt? It's like,
Yeah.
to be fair, yes. It's not pain-free. Does it hurt like a shot that you get at your doctor's office? No. Um, the needles are so small, when I place them in the right place, what you're going to feel is sort of a muscle pulse and almost feels like a localized cramp for just a period of time. Dull, achy sensation is generally, you know, the biggest sensation that you get. Um, when that local tissue is essentially uh, um, going through its relaxation response, sometimes you might feel it shoot down your leg or shoot down to another location. That's all normal things, and that's part of that process of deregulating that bioelectricity that gets trapped in that muscle. So
Okay.
that electricity goes to the shortest route possible, and sometimes it'll you know um, get other tissue involved, just right around it, just adjacent tissue, or if there's a nerve that's closest, that electricity will just pulse right down to your foot, we'll say.
Okay. Well,
So
I
it's a
don't
weird
see.
sensation, but that's what it's about.
Yes, and it maybe I guess we could have to close by saying it hurts so good.
Yeah, well, it's efficient. It's almost like it's like, yeah, you will feel it. And the first time I tell people, the first time is always the worst because, like I said previously in this conversation, the first time, people are coming in at almost their worst because they've tried Avenue A, B, and C, and they don't know what else to do. And so then they get to my office somehow, and it's not going to be a fun experience, but it helps tremendously, and it is so efficient to get that muscle relaxed.
Right.
It's a tremendously efficient catalyst, especially deeper muscle groups that nothing else can really get to. Sciatica,
Yeah,
uh, yeah,
I know that one.
hips, lots of different muscles that are deep that you can get a massage or something, but just doesn't cover it.
Well, here's our very last question. What's the
Okay.
name of your practice? Question mark, question mark.
Say that one more time.
What's the name of your practice?
Oh, Blue Ginkgo, Center of Chinese Medicine.
Blue ginkgo.
Blue
And the
ginkgo,
ginkgo
like the
tree?
tree,
Yeah,
like the
it's
tree.
ancient. Yes.
Yeah, so I came up with that name because I propagated. So when I left K-State, they had on campus, they had two trees, one female and one male in proximity to each other. And so I took about 30 of those seeds at the end of the semester to take home, and I propagated them. And the way you have to propagate ginkgo seeds, only humans can do it. They're not propagated in nature anymore because you have to replicate a particular type of dinosaur going through their digestive tract. So these fleshy seeds, if you've ever seen ginkgo seeds, they're gross smelling, fleshy seeds that smell like throw up, actually, vomit. Butyric acid is actually but they smell like vomit. They're horrible. You have to scrape all that off, wash them in an acid bath, essentially, and then you have to take a razor blade and cut the outside of that seed to simulate dinosaur teeth. And so then they go into soil and then they propagate. So there was one of those 30 seeds that had this like just almost like just a blue green, not like a normal green. It was a blue green. And of those 30 seeds, I gave them all away eventually, but that's where I came up because that species of tree to me represents resiliency. It's still here after millions of years. It's outlived all of its natural predators and disease, and but it's got a vulnerability to it as well, that it can only be propagated with human help. So I thought that was a really good symbol for healthcare and medicine.
That is a good symbol. And Kathleen has put in the chat box the information, the name of his practice, the address, the telephone number, and also the email address or the website. So,
Yeah.
and before that, there were several comments, Jason. You work good backwards because love,
Oh
love,
man,
love the presentation. So
new
informative. Thank you.
experience.
Thank you. Thank you.
Yeah, and if anybody ever has additional questions that they don't want to necessarily, plug publicly, give me a holler. I'm always very honest about what I can and can't do in this practice. So
Okay.
where I can find you the right people. So
Okay. Sounds great. And
all
I
right.
appreciate your hour
Yeah.
working from behind the desk.
Thank
Um,
you, Laura.
thank
Thanks for
you.
inviting me.
Thank you so much for being here. And thank you everybody for listening in. And we'll see you next time. We're going to be speaking with a woman who does hypnotherapy. So, and somatic counseling. So we'll figure that out as well. Thank you so much, Jason, and everyone. Stay cool. And we'll see you next time or at the next retroactive event. Thanks
Thank
for
you.
being here, everybody.
Thanks, everybody.